Imagine a world where newborn babies are at risk of contracting a deadly virus that can cause liver disease, cancer, and even death. This is the harsh reality of hepatitis B, a highly infectious disease that can be transmitted from mother to child during delivery. But here's the shocking part. The Centers for Disease Control and Prevention, CDC, has been considering a change to its vaccine recommendations that could put thousands of babies at risk. The controversy surrounding the hepatitis B vaccine has been brewing for months, with some experts questioning the medical necessity of administering the vaccine to newborns whose mothers have tested negative for the virus. And this is the part most people miss. The CDC's Advisory Committee on Immunization Practices, ACIP, recently voted to delay a decision on the matter, citing a lack of evidence about side effects and the need for more discussion. But what does this mean for the future of vaccine policy in the U.S.? The ACIP's decision has sparked a heated debate among public health experts, with some arguing that the vaccine is overwhelmingly safe and has helped to virtually eliminate hepatitis B infections among newborns. Others, however, claim that the vaccine can cause neurodevelopmental side effects and that more research is needed to fully understand its risks. The issue is further complicated by the fact that many pregnant women in the U.S. are not screened for hepatitis B, making it difficult to rely on testing to decide which children to vaccinate. According to the CDC, 12 to 16% of pregnant women in the U.S. are never tested for hepatitis B during pregnancy, and even if they are, some cases can be missed. So, what's the solution? Should the CDC recommend delaying the first dose of the hepatitis B vaccine until a child is at least 1 month old? The answer is not a simple one, and it's clear that more research and discussion are needed to fully understand the risks and benefits of the hepatitis B vaccine. But one thing is certain. The decision will have a significant impact on the health and well-being of thousands of babies in the U.S. As Dr. Cody Meissner, a pediatrician and ACIP member, noted, when you apply that to a newborn hepatitis B vaccine, I don't think there's any question whatsoever that the benefit far outweighs any adverse side effect. But others, like Dr. Robert Malone, argue that the absence of data proving the vaccine's safety does not necessarily mean it is safe. The controversy surrounding the hepatitis B vaccine is a complex one, and it's clear that there are valid arguments on both sides. But as we move forward, it's essential that we prioritize the health and well-being of our children and take a careful, evidence-based approach to vaccine policy. So we ask you, what do you think? Should the CDC recommend delaying the first dose of the hepatitis B vaccine, or should they stick with the current guidelines? Share your thoughts in the comments below. The future of vaccine policy in the U.S. is a topic that affects us all, and it's time to start a conversation. But here's where it gets controversial. Some Republican legislators, including Rand Paul of Kentucky, have questioned the medical necessity of protecting newborns if their mothers have tested negative for the virus. And this is the part that sparks debate. Should the government be involved in vaccine policy, or should it be left up to individual parents to decide what's best for their children? The issue is a complex one, and it's clear that there are valid arguments on both sides. But as we move forward, it's essential that we prioritize the health and well-being of our children and take a careful, evidence-based approach to vaccine policy. The CDC's decision to delay a vote on the hepatitis B vaccine is a step in the right direction, but it's only the beginning. As we continue to navigate the complex world of vaccine policy, it's essential that we stay informed, stay vigilant, and always put the health and well-being of our children first. The future of vaccine policy in the U.S. is uncertain, but one thing is clear. It's time to start a conversation. So, let's get started. Share your thoughts, ask your questions, and let's work together to create a healthier, safer world for all of our children.